bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
All right, hello everyone, and welcome back from a short hiatus for today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today we're going to be talking about honoring Jordan's principle, putting kids first. For those of you who don't know about Jordan's principle, we're going to hear lots more about that following or from our presenter, who I'll introduce in just a moment. Many of you are certainly familiar with the concept of Jordan's principle around, a child-centered approach to ensuring that children are not discriminated against, particularly First Nations children, as far as accessing healthcare services, and not only healthcare services, but other government services as well, around education and social services, etc. Certainly an issue that CAFC's community has talked about for many years, and the equitable access to services for Indigenous children and youth is one of CAFC's current priorities going forward for the next few years. So this is a great topic and certainly of great interest to our community. As we can tell by the audience today, we have a very large audience that was interested in this presentation. So without any further ado, let's get into the presentation. It's my pleasure to introduce Jennifer King from the First Nations Caring Society. Jennifer is their Reconciliation and Policy Coordinator, and Jennifer is Anishinaabe from Wasauksing First Nation. Jennifer has been working in areas of research, policy, and public engagement in support of Indigenous women and children for over 10 years. With a master's degree in social work, she has a focus on Indigenous methodologies and Indigenous perspectives on policy and practice. So it's my pleasure to hand the virtual podium over to Jennifer King. Over to you.
Well, thank you, Doug, and thank you all for joining us I guess it's still the morning, it feels a lot later, joining us this morning to talk about something that I think is very dear to many of us, and that is Jordan's principle. So in my presentation today, I'm going to talk a little bit about, of course, what Jordan's principle is. I'm going to talk about the case at the Canadian Human Rights Tribunal that translated Jordan's principle from a principle to a point of Canadian law. And I'm going to talk about what the orders put forth by the Canadian Human Rights Tribunal mean for all of us on the ground who are working with kids and families. And then finally, I'm going to close by talking to you about something called the Spirit Bear Plan, which is something that my organization, the First Nations Child and Family Caring Society, has put forward as a opportunity to address the many systemic inequities that First Nations kids and families continue to experience. And I'm also going to share with you some other ways that you can show your support for Jordan's principle and equity for First Nations kids more broadly. So please, if you have questions, do type them in to Doug. I think I'll maybe break at the midway point to see if there are any questions, because I really would like to deal with some of the misinformation about Jordan's principle that's been passed around over the years. After Jordan's principle, as we'll talk about, after Jordan's principle was passed in the House of Commons, the government immediately began to narrow the definition of Jordan's principle. And I think some of that misinformation that was, put out in the years that followed still remains, and we want to make sure that children and families are receiving the full benefit in the spirit of Jordan's principle and in honor of Jordan River Anderson. So that is the title of my talk today, Put Children First. And this is actually something that often appears on the signs at the Jordan's Principle Parade in Norway House Cree Nation, which of course is where Jordan River Anderson was from. And this is a picture too from one of the parades that takes place every year. So to begin, I'd actually like to share with you a short, it's about 3 minutes long, public service announcement that was put together by young people from Pierre Elliott Trudeau School in Gatineau. And, the point of this video is really to let people of all ages and backgrounds know that Jordan's principle is something that should be very simple. It's about putting kids first, and I want you to hear it from them. So Doug, if you could play that video, I would be most grateful.
Jordan's principle is a legal rule named in memory of a very special little boy named Jordan River Anderson. Jordan was born in the hospital with a very serious health condition. When he was 2 years old, doctors said he could go home. His family was so happy. All the services that Jordan needed at home, like medicines and helpers to keep him healthy, were in place. But the provincial and federal governments could not decide who would pay for his home care, and they began to argue. They continued to argue for 3 years until Jordan passed away when he was 5 years old. Jordan had stayed in the hospital and never got to spend a day or a night in his home because of the arguing. Jordan's principle makes sure that when a child needs services, they get them right away. This applies to all services, including healthcare, education, and child welfare, and to all First Nations children on or off reserve. Jordan's principle says that arguments about money should not stop kids from getting the help they need, like visits to doctors or extra supports in school when they need it, which means that no child will ever have to wait like Jordan did just because he was First Nations. Jordan's principle is simple, but it is extremely important because it ends discrimination. Every child, no matter who they are or where they live, should get the services they need to grow up healthy and proud. It is also important because to actually make things better in Canada, we need to take action. Lots of people talk about reconciliation, but what is it? Reconciliation is about taking action to make things right. Fully implementing Jordan's principle is a big step towards making things right in Canada. It was the Truth and Reconciliation Commission's third call to action. There are many children where Jordan's principle can help. If your child or someone you know needs services, there's help. To refer a Jordan's Principle case or to get more information, call the number or visit the website on your screen.
We're kids from Pierre Elliott Trudeau School in Quebec, and we have a message for all adults. Jordan's Principle. Put children first, please.
Okay, so once again, thank you to the young people of Pierre Elliott Trudeau School for their awesome work on that public service announcement. I want to acknowledge that they did the script entirely on their own. Of course, as a public service announcement, we gave them some parameters. You have to explain what Jordan's Principle is, and felt that it was important to mention that Jordan's Principle was specifically named as a call to action by the Truth and Reconciliation Commission. But beyond that, they came up with it themselves, and I think they did a really beautiful job. For those of you who aren't familiar with the story of Jordan River Anderson, I'll just take a couple of minutes to share the story of this beautiful little guy. So Jordan was born with quite complex medical needs. He was, as I said, from Norway House Cree Nation. He spent the first 2 years of his life in hospital in Winnipeg while doctors worked to stabilize his condition. At that time, it was decided that Jordan could go home. He could go to a family home setting, provided that the necessary medical equipment and home care was in place. It was at that point that the provincial and federal government started to argue over who would pay for those things that he needed in the home. These were services and supports that would have been provided without question if he was not First Nation, but because healthcare is under provincial jurisdiction and First Nations health services are, of course, under the jurisdiction of the federal government, there was a disagreement over who would pay. And rather than putting Jordan first, rather than putting the child first, he was left to spend the next years of his life in hospital unnecessarily. And he passed away at the age of 5, never having spent a day in a family home. So in his memory, in hopes of making sure something like this never happened again, Jordan's family gave his name to a Child First principle called Jordan's Principle, which said very simply, when a child needs services, they should get those services right away. So Jordan's Principle was passed in the House of Commons in 2007. It was passed unanimously, meaning that every member of Parliament stood up and said, yes, we support Jordan's Principle. We support a child first policy, which will make sure that no child will have to go through what Jordan did. And the idea was very simple, that when there was a jurisdictional dispute or when there was uncertainty about whether a service was available or, who should pay for that, the government department of first contact would pay and the administrative issues would be dealt with behind the scenes later. But the idea was very simply put the child first. Unfortunately, pretty much immediately upon passing Jordan's Principle as a policy in the House of Commons, the government of the day started to narrow the meaning of Jordan's Principle in ways that were not in keeping with the spirit or intent of Jordan and Jordan's legacy. So many of you have probably heard some of the old policy talk about what Jordan's Principle is. The government narrowed the meaning of Jordan's Principle to apply only to cases involving a jurisdictional dispute, involving a child with complex medical needs with multiple service providers. In 2009, the government set aside $11 million to address Jordan's Principle cases, and 0 cases were accepted or funded. Given the narrowness of the definition at that time, you have to wonder if Jordan's family had applied for services or support for Jordan, would he even have been accepted? And that's kind of what happened when we hear about, Jordan's Principle being complicated or difficult to access. That was entirely the policy framework that was put in place. It has nothing to do with as I said, the spirit or intent of Jordan's Principle, but rather how it was implemented. Now, in 2007, the First Nations Child and Family Caring Society, of which Dr. Cindy Blackstock is the executive director, we filed a human rights complaint along with the Assembly of First Nations in regards to the underfunding of child welfare in First Nations communities. Jordan's Principle was also part of that complaint. The complaint talked about how Jordan's Principle had been narrowed by the federal government, as I said, in ways that were not in keeping with the spirit or intent. And so as the case wound its way through the tribunal process over a period of 9 years, Jordan's Principle, was part of the proceedings, was evidence was presented to the tribunal panel in terms of, the exact wording of the motion. So the House of Commons motion 296 stated that in the opinion of the House, the government should immediately adopt a child first principle based on Jordan's principle to resolve jurisdictional disputes involving the care of First Nations children. There was nothing in that motion that referred to multiple service providers or children with disabilities. Thankfully, after 9 years in the tribunal, going through the tribunal process, the case was won. There was a victory in the year 2016. The tribunal ruled that, yes, Canada had been discriminating against First Nations kids in the underfunding of child welfare, and also in the way that they had narrowed the definition of Jordan's principle, their failure to properly implement Jordan's principle. So that was a huge victory. A lot of celebration, a lot of really wonderful response from communities and from service providers. Unfortunately, as we'll talk about a little bit, there have been some bumps since that time in terms of seeing the tribunal's orders properly implemented. The Canadian Human Rights Tribunal has retained jurisdiction to monitor government compliance. So that means that every so often, the government and the complainants in the case, which is the Caring Society, the Assembly of First Nations, and other interested parties, get together to talk about what has been done, what needs to be done, and then the tribunal issues further orders as to whether Canada, as the party that was found guilty of discrimination, if they are complying to the tribunal's decision. So as I said, since the decision in January 2016, the tribunal has issued 4 non-compliance orders. So meaning overall there have been 5 decisions in this case, the original decision in 2016 and 4 non-compliance orders. The first one was in April 2016, and this was basically the tribunal saying, our orders were meant to be implemented immediately. So something that you should understand is that everything the tribunal has commented on to date has been in terms of immediate relief, things that Canada needs to do to address the most egregious aspects of the discrimination that was taking place against First Nations kids. We're not talking about long-term solutions or even midterm solutions. We're talking about things that needed to be done in the immediate time period, the very short term. So the decision was released January 26, 2016. In April, after concerns were raised by the Caring Society, Assembly of First Nations, and others, the tribunal commented to say, it's been 4 months. This is the things that are taking place are not being done in what we would consider an immediate way. So we had that first additional order, the first non-compliance order. This was followed by September, another non-compliance order in September. And with each order, the tribunal was getting more and more specific in terms of the actions that Canada needed to take to address the discrimination and ensure kids were being treated fairly. So one of the really excellent things about the compliance orders, not just in terms of, that we have this legal body monitoring to make sure that discrimination is being addressed, but the orders are very specific and they outline very particular things that Canada needs to do. So the first 2 in April and September were, I would say, general. They talked about both the aspects of child welfare and they talked about Jordan's principle. In May 2017, the tribunal issued another compliance order, and this one was specific to Jordan's principle. The entire decision was talking about what the government needed to do to really honor Jordan's legacy to really honor the spirit and intent. And I've attached a handout for the group which summarizes those orders and lets you know exactly what the tribunal has said, and which where you can find the precise the precise paragraphs pertaining to the orders discussed. So that's there for you. The order itself is also on our website at jordansprinciple.ca, so you can read the full order, the full words of the tribunal, and that's also available in French. The fourth non-compliance order, which was issued just this past February, that dealt with the child welfare aspect. So as I said, with each order, the tribunal was getting more and more specific, and they decided they needed to address the two elements of the case, Jordan's principle and child welfare, separately to ensure that things were being dealt with as they needed to. Doug, have there been any questions specific about the tribunal that now would be an opportune time to address?
Yeah, there was a question that came in when you first started talking, when you first introduced Jordan's principle. The question was basically asking if Jordan's principle applies only to First Nations kids, all Indigenous kids, including Inuit and Métis children, or all kids in general.
Okay. So Jordan's principle was born out of the situation that was experienced by a First Nations child. And due to the way jurisdictions are set up in Canada, what happened to Jordan happened to him specifically because he was a First Nations boy. If he was not First Nations, he would have gone into his home care situation, and the provincial government would have stepped in and paid for the services he needed because healthcare falls under the provinces. In the case of First Nations kids, we also have that other layer where the federal government is responsible for providing healthcare services to First Nations who normally reside on reserve. So that was the jurisdictional piece that prevented Jordan from getting the care that he needed, where the provinces said, no, First Nations healthcare is the responsibility of the federal government. And the federal government said, no, healthcare is the responsibility of the province. And so neither one wanted to put the child first and make sure that he got what he needed. So Jordan's principle is specific to First Nations kids. The reason for that being that it was born from a situation that affects First Nations kids in a unique way. Now, since that time, our organization, the Caring Society, and ITK, which is the organization representing Inuit in Canada, we have taken the position that Jordan's principle should apply to Inuit as well, for the reason being that Inuit find themselves in the same situation where care for Inuit is provided by the federal government. But when Inuit are traveling or in different situations in different provinces, they're finding themselves caught in that jurisdictional piece as well. So it does not make sense for the tribunal to say that what happened to Jordan, was discrimination, and that Jordan's principle needs to apply to ensure substantive equality for one group, whereas Inuit are also finding themselves in the same situation. Métis are not governed by the federal government in terms of healthcare in the same way. That's not to say that there aren't Métis-specific issues that need to be looked at, but our organization is First Nation specific, and so we don't want to be speaking for the needs of Métis families or communities. So I hope that clarified things, or perhaps just made it more confusing.
Yeah, I think if nothing else, it certainly helps I think the audience understand, particularly the healthcare providers out there, understand the level of complexity that these families have to deal with and the lack of consistency, and why it is such a challenge for people to get services, why it's easy for agencies to deny services because they don't understand the what the rules are, et cetera, et cetera. It's just very, very complex. So your answer, I'm sure, has answered the question, but certainly has highlighted what the complexity that is out there.
Yeah.
A couple more questions that have come in. And this one's sort of related to that, and some of these are sort of related to the bigger discussion that maybe we'll save to the end. But I'll just maybe take a couple more. The one question was asking about kids who do not have status. Are they included in this or no?
Okay. So there, as I've talked about, there are ongoing compliance issues. Jordan's principle, and I'm going to be getting into some more specific details around who exactly who can refer a Jordan's principle case under what circumstances. The tribunal referred to all First Nations kids. They didn't say anything about status. We at the Caring Society have unfortunately seen a narrowing as of late, where the government is not honoring Jordan's principle in cases involving non-status kids. Our position is that is not in compliance, that Jordan's principle applies to all First Nations kids. If you, as a service provider, know of a family who has a non-status child and wants to apply for Jordan's principle, we encourage you to do so, because these cases need to be put forward so that the tribunal can then take a look at Canada's response. And certainly, if you've come across as service providers, or if you know people in your life who have tried and been denied, we are interested in hearing about that. And I would encourage you to get in touch with me personally so we can discuss further. I'm just gonna.
And I think we do have quite a list of questions that are piling up here. But I think we'll save for the end. We'll let you get a little further.
Okay.
You can feel free to stop at any other point, and if you do want to take some questions, but there are some really, really interesting questions that are building up here. So we'll let you.
Perfect. So I'll just breeze through this timeline then, so that I can get further along into some more of the specifics of the tribunal's orders. So just to give you a sense of everything that's transpired, we had the founding of Jordan's principle with Jordan's passing in 2005. The House of Commons unanimously passing Jordan's principle in 2007. The human rights complaint filed around that same time. Canada beginning to narrow the definition, telling people that Jordan's principle applied only to cases involving First Nations kids with complex medical issues, multiple service providers. So narrowing the definition in a way that was not correct and not in line with what Jordan's principle actually is. 2016, the Canadian Human Rights Tribunal finding Canada to be discriminating against First Nations kids, and also commenting on Jordan's principle, which at that point translated Jordan's principle from a statement, a principle, to a aspect of Canadian law, so a legal rule. So, it's not codified in Jordan's principle isn't codified in legislation, but through its inclusion in the Human Rights Tribunal case, it is now a legal rule. We have the 4 compliance orders, and I'm happy to say that since that specific ruling by the Canadian Human Rights Tribunal on Jordan's principle, in 2017, 70,000 First Nations kids have received services under Jordan's principle. So it's very interesting when we look back at the government's initial claim in 2009 that they had set aside $11 million, but there wasn't one single case, to all of a sudden there's 70,000 kids who needed services in the matter of 1 year. So that really goes to show how it was an issue of, not an issue of political will, more than lack of need. Okay, so let's get into the nitty gritty, which might answer some of the questions that have come through to you, Doug. These are the key elements of Jordan's principle as per the Canadian Human Rights Tribunal. Basically, they started out by saying that Canada's previous definitions were too narrow and thus discriminatory. And we've talked a little bit about how that narrowing of Jordan's principle was not in keeping with the spirit of Jordan's principle. And the tribunal found that as well and ruled that to be essentially illegal. Jordan's principle applies to all First Nations children on and off reserve. So you don't have to be ordinarily resident on reserve to receive benefit under Jordan's principle. Again, the tribunal has said that it applies to all First Nations children. We have seen narrowing by Canada in terms of refusing to cover non-status children. As I said, our position at the Caring Society is that that is not in compliance with Jordan's principle, and we are, encouraging everyone, status or non-status, to put forward those cases and to get in touch with us if they receive a denial due to not being considered a status Indian. Jordan's principle applies to all public services. This includes assessments. This includes travel. Okay, so talking to providers, I've heard that a common issue is that child maybe lives up north. They might be able to get the child down south to receive a service, to be seen by somebody, but there are no funds for travel, or travel is a barrier. Jordan's principle includes travel, so this should no longer be an impediment to kids getting the services they need. Another important piece is that we're talking about substantive equality. And so, you might be thinking some of the things that I've talked about in terms of assessments or travel, these aren't normative standards, right? These aren't things that are always available to non-Indigenous kids. But what the tribunal did in this ruling was really recognize that equality isn't about treating everybody the same. And we're talking about substantive equality here to ensure that kids who for generations have received less than everybody else, who have been dealing with racism on a variety of fronts. And so we need to do whatever we can to ensure that we are making decisions according to the best interest of the child. And that's really what Jordan's principle is about. We've moved beyond this narrow idea that we need to be talking about multiple disabilities and multiple service providers. We are back to the substance of Jordan's principle, which was also always about the best interest of kids. According to the tribunal's rulings, Canada is legally obligated to get back to you with an answer within 12 to 48 hours. If you were to call with an immediate issue, something of kind of a life or death situation, they need to be making a decision basically immediately, right on the phone with you. For things that are more of a routine request, they still need to be getting back to you within 48 hours. And this is because the tribunal recognized that the administrative process associated with the previous implementation of Jordan's principle was so burdensome and so lengthy that they needed to put into place specific timelines that the government would be responding to. Administrative procedures, so in the past, things like case conferencing were used in ways that would slow down the decision-making process. So again, going back to this timeline of 12 to 48 hours, that decision can't be held up by saying, oh, well, we need to confer with others, right? The decision needs to be made within that timeline. Something that is really critical, moving along to the next point to understand, is that Jordan's principle has no end date. So Jordan's principle is now a legal rule. It's not a program. You might have heard about the Child First Initiative, which is the means through which Canada is currently implementing Jordan's principle. My understanding is that the Child First Initiative is set to sunset in 2019, but that's the program. That's not Jordan's principle. Jordan's principle is not the Child First Initiative. As I said, the Child First Initiative is the means for implementing Jordan's principle, and maybe that means is going to change. But Jordan's principle as a legal rule that says First Nations kids should have access to the services that they need when they need them, that is forever. And that's something that we all need to be confident in. Finally, Canada is required to inform you of the appeals process. So if the case is denied, you should be informed in writing about that appeals process. I want to let you know that as it stands, the focal point, so the person that you would be initially talking to who would be making that initial assessment, they do not have the authority to deny a case. They only have the authority to approve, which is really awesome. If they feel that the case falls outside the bounds of Jordan's principle and their recommendation is to deny, they need to kick that up to headquarters, to the national office. And it's only, I believe it's director level folks in the federal government who would be reviewing these cases and making that decision. I'm also very happy to report that there is now a 24-hour reporting line. So that's the number there. There is a website, a Government of Canada website for Jordan's principle that lists the various contacts in each province and territory. But you can just call this number. It's a little more straightforward, and they will refer you on to the person who is best suited to handle your case. I should also say that anyone can report a Jordan's principle case. So as a physician or a service provider, as a community member, you can call about a child in need, and it's the government's responsibility to work that out, to get in touch with the family and to make sure that that child is in fact, as I said, getting what they need. So after that lengthy discussion, Doug, do you want to revisit that list of questions? Because I think this is kind of the part of the presentation where we're talking about, as it says, key elements of Jordan's principle.
Yeah, the one question that came in that's kind of interesting, particularly for this audience, was asking about how Jordan's principle relates to healthcare organizations as opposed to government agencies. And I think what she's asking is, what's the responsibility of, say, a hospital or a children's treatment center or what have you to deliver services, or what's their obligations versus their rights versus, and the organization is always concerned, whether up front or after the fact, about getting their own reimbursements when they bill the government. Are they going to get paid back, et cetera? That's obviously one of the things they have to deal with behind the scenes if they deliver the services up front, et cetera. So can you give us any insight into what the organizations are required to do, or what options they have? Or
So I think always we're talking about the best interest of the child, right? What does the child need? And that's what's going to be driving decision making. In terms of a longer term programs, I am aware of some treatment centers in Ontario that were able to work with the government under Jordan's principle to put together programming to bring in kids from the north, bring down kids from the north to receive their services. So, some agencies, organizations are aware of needs in communities with kids who are on wait lists or things like that. And so there is opportunity under Jordan's principle to put in proposals to serve groups. Yeah, I think that's pretty much all I can say about that. But
All right. And there were a couple questions sort of related to something that you mentioned there. So the question, as it was put in, was: does Jordan's principle apply to the creation of services or just to the administration and provision of services? Sort of because, and there was another question sort of but from someone else about the whole child first, or, the child first principle. So if a service is not at all available or doesn't exist, but the child needs it, again, is there that creation of service? You sort of mentioned the need to create a program to bring children in, so that was likely a service that did not exist. So some resources had to be created to, or put to the creation of that service. But how far would that go as to the creation of a service that does not exist to meet the needs of a child?
So there's kind of two pieces, right? If the child needs a service that does not exist in the community, the expectation would be that travel would be provided so that the child could get that service at the nearest location. Then there would be the more long-term piece where you would be looking at submitting proposals for the creation of services. That's like a longer term piece, but I have had conversations with groups, midwives, occupational therapists, and various people who are looking at the lack of services, especially culturally appropriate services for First Nations kids, and how Jordan's principle can be used for the creation of new services that are so greatly needed, and certainly mental health services and all these sorts of things that we know are needed. Now there's that opportunity to really look at their implementation. So my best recommendation would be to, call the number and say you want to talk about it.
How would that apply? One of the other questions was about sort of a wait list situation. So if the child needs a service, but there's already a wait list that other non-First Nations kids are also on, does Jordan's principle just allow that child to be placed on a wait list for services that they really need along with all other children? Or again, is there a way to lever Jordan's principle to address the wait list issue, whether it's putting more resources towards it, et cetera?
I don't think the intention of Jordan's principle is to, to skip over the lists, but I think there might be perhaps a way to perhaps look at accessing services in a different place. There are just more options. I think that Jordan's principle is giving people more options in terms of, where they can go. Yeah.
Mm-hmm. All right. One of the much more straightforward question I would think is, because a lot of these are very complicated questions. You can tell the audience is really sort of struggling with these issues in their own practice and have spent a lot of time thinking about these, I'm sure. But the one question that just came in was around the age. Does this apply to up to 18 or
18,
apply into adulthood or no?
Up to 18. Again, my recommendation is always to call and to see. So, there were a lot of kids who, during the years after Jordan's principle was passed, should have been eligible for services, should have been eligible to receive supports, and didn't receive them due to how Canada had narrowed the definition. The tribunal ordered Canada to go back and retroactively look at cases that they had denied, and to determine whether or not, those denials were unjust. So again, always the recommendation to call. If the child is over the age of, or the young person is over the age of 18, would they have been receiving services in the past? If Jordan's principle had been implemented properly, perhaps. And so there might be some room there to provide that support now.
Now, is there a similar rule related to First Nations adults that are not receiving services that other adults would have, or is that
Jordan's principle is specific to children, and at this time, that's what we have.
Okay. So the adult issue has just not been tested in the courts or in the
yes
in a human rights case or anything. Okay.
Yeah, definitely. I've heard the same thing. I also, on occasion, teach a course at the University of Victoria, and when we talk about Jordan's principle, I've had students tell me about cases involving adults. I had one student talk about how there was a First Nations woman in palliative care. There were some other things that could have, been done for her palliative wise, but the people at the home basically said, there's not really any point in trying to get these for her, because by the time the process works its way through with the federal government, it'll be too late. So certainly these issues that we're dealing with for children extend to adults as well. But it is in Jordan's honor and Jordan's memory that this particular principle has now become a legal rule.
Just to clarify, and we've gone over this a couple of times, but I had quite a few questions around, Inuit versus Métis versus on versus off reserve. You're suggesting that Inuit children or families, First Nations on reserve, everyone should, if in doubt,
yes,
call the Jordan's principle line and report the case there, if in doubt.
Yes. So Indigenous, as we know, that's referring to First Nations, Métis, and Inuit. And sometimes, we hear the suggestion that, Jordan's principle is somehow unfair because it doesn't apply to all Indigenous people. And to that, I would say that we need to understand that the issues impacting First Nations, Métis, and Inuit are different. And it does a disservice to not respect the diversity of the various groups. Even within First Nations, the diversity is huge. Our organization, we work with First Nations, we work with and for First Nations kids and families, and we're not, it wouldn't be right for us to speak on behalf of Métis. We have done work with ITK, which is the organization representing Inuit, on Jordan's principle. And because of the similarity in terms of First Nations Inuit Health Branch, so that's a department of the government specifically called First Nations Inuit Health Branch, that was by and large really the group that was putting up the barriers that led to Jordan's passing. If the tribunal found that the way things were being done was discriminatory, then it follows that Inuit, who are also covered by the same group, are experiencing similar issues. And so that's why, the more that we can get people calling and reporting these cases, also getting in touch with ITK to let them know about any denials that have been experienced in regards to Inuit kids. These are things that we can do to try to raise awareness about, the need for the government to acknowledge the full scope of Jordan's principle.
All right. I wanted to check in with you. Do you have more presentation that you wanted to get through, or should we just continue with the questions?
I guess what I'll just quickly go to that I want to talk to people about is the Spirit Bear plan.
Sure. All right.
So I don't know if the group is aware or knows Spirit Bear, but he's becoming quite a well-known figure. Spirit Bear is actually a member of our team here at the Caring Society. He was gifted to Cindy Blackstock by Carrier Secondary Family Services back in 2008. And Cindy started bringing him to all the tribunal hearings. And, he started to get, people would start to say, hey, where's that teddy bear? She really treated him as a a witness on behalf of all the kids, the 165,000 First Nations kids who were affected by the case. Over time, he got his name, Spirit Bear. He was given his ribbon shirt and his medallion and the other things you see in the picture. And he has really become, as I said, a well-known, as we would say, ambassador for reconciliation. And he has put forward what we call the Spirit Bear Plan, recognizing that the inequities in child welfare are just one piece of the broader systemic issue in terms of underfunding across the board for First Nations kids and families. So the Spirit Bear Plan, which has been endorsed by the Assembly of First Nations Chiefs of Ontario, we've been talking about it with other groups. I was at a talk with the Manitoba Federation of Labour last week and presented it there. The Spirit Bear Plan is calling on Canada to immediately comply with all of the tribunal rulings. So, that includes the child welfare piece, and to fully implement everything that the tribunal has said in regards to Jordan's principle, and to address some of these outstanding pieces, like the denial of cases for non-status kids, like the, refusal to acknowledge the way the department also has jurisdiction over Inuit kids. The second piece of that is asking Parliament to publicly cost out all of the shortfalls in public services. So this is things like maternal child health, education, clean drinking water, housing, and to propose solutions. The Parliamentary Budget Officer has already done some studies on education, and we're asking for a study to be done that would be looking at the shortfalls across the board. The piece here is that the Parliamentary Budget Officer can't just unilaterally decide what they're going to look at, but they need, that office needs direction from parliamentarians to take that on. So we are asking organizations, groups such as yourself, to endorse the Spirit Bear Plan as the next step, because, as these questions are demonstrating, the inequities are deep. There's a lack of services in the communities. There's lack of options for people. There's service providers wondering what they need to do to ensure that the best interests of kids are met. And so we need to move beyond a piecemeal approach where we're kind of looking at things in silos, we are looking at things in silos where, okay, let's implement Jordan's principle, but not address underfunding in education, or let's look at child welfare, but not think about how the overrepresentation of kids in care is tied to underfunding and poverty across a whole other set of systems. So this is the Spirit Bear Plan. Spirit Bear represents, as I said, the 165,000 kids impacted by the case, and the many thousands of non-Indigenous kids who stood up and followed the tribunal and continue to follow the tribunal. And I've attached a copy for your consideration. I do have a few more slides, but because I think there were a lot of questions, I would be happy to take the remaining time to try to address some of those.
All right. Well, let's just as Jennifer pointed out, we do have the attachments are in the you should be able to just click on them and download them. The Spirit Bear Plan, the information about the timeline around the Human Rights Tribunal, et cetera, are all in the control panel, and you should be able to download any of those right now. And we'll also put them on the Knowledge Exchange Network for you to access after the fact as well. Let's see, we do have lots of questions there. One of the questions that came in was asking about, so I think this would be from the perspective of a healthcare provider, for example, who is concerned about a case and wants to call the Jordan's Principle line and make a report of some sort. Mm-hmm. Is there any issues related to the Personal Health Information Act as far as reporting a case? Are they allowed to give details about the case that could be identifiable? Is there a consent form of any kind required, or do you have any information about that?
So there is a process on the government's end. I would think and hope that the government of Canada was in line with its own laws in terms of the sharing of health information. Certainly families have been submitting, assessments and that kind of stuff. So that is a concern, but also keeping in mind that we don't want to we don't want to have that administrative, I guess, worry override the spirit of Jordan's principle, which is let's call in, let's talk about what this child needs, and adhere to the processes that that are in place. So let's not let the fear of that get in the way of trying. If that makes sense.
Yeah. All right. There were a number of questions that came in, sort of asked along the lines, sort of within the theme of the breadth of the services that would be covered by Jordan's principle. We're obviously, you've mentioned a few times, there was that narrowing of the definition to complex, very specific medical healthcare services. We've had some questions about housing, for example, particularly housing to support patients with medical complexity, or what about healthcare services provided in the education sector, or even things that some people might not consider healthcare services in the education sector, more learning support, developmental.
There have been families who've applied for educational assistance and received supports for that. Things like ramps for houses, so things that would be needed to make the home safe for the child. All of these sorts of things are covered.
All right. One person's asking, is Spirit Bear for sale? Can someone buy a Spirit Bear?
Spirit Bear is not for sale, but we do have a Spirit Bear book, actually. So this was written by Cindy Blackstock with the help of Anishinaabe writer named Eddie Robinson. It was illustrated by Amanda Strong, who is a really well-known stop motion animator. So you can find information about this book on our website, so fncaringSociety.com/Spirit Bear. You can also find the Spirit Bear plan there. The book is targeted for kids roughly in the age group of, I would say, like grades 2 to 6. We also recently launched a learning guide to go with it. So no Spirit Bears for sale, but we do have a Spirit Bear book. And so thank you for giving me the opportunity to share that.
All right. Just trying to, we only have about 3 minutes left in our scheduled time. We have quite a few more questions, so I'm trying to pick a few that might be representative of the group. One of the questions that came in was asking about tools and resources or equipment versus personnel would be covered, and I'm quite sure, if I can answer this for you, that personnel would be covered. Like, for example, home care nurses or that sort of thing. That would all be considered within the scope, right?
So one thing I just want to kind of leave people with is, I don't want, we've talked about how the issues are complex. The issues may be complex, but Jordan's principle is meant to be really simple. It's meant to, as I said, to be focused on the best interest of the child, to ensure that First Nations kids get the services they need when they need them, in the spirit of Jordan River Anderson. So if you know of a First Nations child, if you work with a First Nations child or with First Nations families, call the number, talk to the people, explain the situation, and see what happens. So as I said, I'm aware of programs and new strategies that have been created through Jordan's principle in terms of bringing kids down to treatment centers. There are talks in place now to create a more long-term solution in which service providers would be flown up to the community. So, just try is always my recommendation.
Yeah. All right. Yeah. I mean, again, we have a number of questions related to things like, just wondering if this is covered or that's covered. If, again, I totally agree with what, or we'll reiterate what you're saying. If in doubt, call the number and see what happens, and they'll give you the information. But we've got lots of questions about, again, I think that it really boils down to if other children that you're seeing in your practice are being given services and First Nations children are not, I think it's pretty clear that there's an issue there. I think that's really the rule of thumb. If this is a service that you would otherwise provide that you are now no longer providing, or you're hearing it from the family in a follow-up that you've instructed a family to go and make modifications to their home or vehicle and to apply for reimbursement or funds or to seek private services that are often reimbursed through government programs, and the family tells you in follow-up visit that they're not being reimbursed, that's the sort of thing that would be a red flag as a potential reason to call the Jordan's Principle number. Is that accurate to say that?
That's definitely accurate. I would go one step further, though, and say the tribunal's ruling was really about substantive equality. And so we're even moving beyond, I guess, what you would call that normative standard, right? So recognizing that First Nations families have been subject to underfunding and discrimination for so many generations that we're looking to that in some cases we need to go above and beyond and to provide services that are really in the best interest of that child in response to the generations of, as I said, discrimination and underfunding, to make sure that these kids really have the best chance in life. So even if it's something that is not ordinarily covered by another government program, if it's something that a First Nations child needs, call the number.
All right. And that certainly clarifies it right there. So I think maybe it's time to wrap up. We'll give you just a couple of things that we'll ask of you before you go. Is people are asking if they can contact you if they have further questions, and if so, where would be the best place to find you?
Yes, please contact me. So email is best, jking@fncaringssociety.com, and maybe we can post that somewhere. My position is 3 days a week, so sometimes it takes me a couple of days to get back to people, but I will get back to you.
All right. And is there anything else you'd like to leave the audience with before we leave? You've got the book up on the screen, the Spirit Bear and Children Make History book. Certainly go to the First Nations Caring Society website and you can get a copy of that, or you can purchase a copy. Is there anything else you'd like to leave the audience with before we leave?
I just really want to thank everyone for their time and participation, and it's always hard on my end because I want to answer everyone's question. And, to be honest, there's a lot of stuff that is still, or a lot of things that are still unclear. The questions that were asked around, privacy and all these sorts of things. I'm operating on the assumption that the government of Canada is aware of privacy laws and health confidentiality laws and all these sorts of things, and have those processes in place. I don't know exactly what their processes are. I don't work for the government of Canada. My role here is to try to let people know what the tribunal has said about Jordan's Principle and what Canada is supposed to be doing. Other things around like the creation of services or how to deal with wait lists. Again, my best recommendation is to call, and when you call, let them know what you want. What does the child need? What would your recommendation be? If the sky was the limit, what would you like to see? What are you asking for? What is really in the best interest of that child? And that's what Jordan's Principle is supposed to be about.
All right. And I think that's a perfect place to wrap it up. So thank you very much, Jennifer, for the presentation. I mean, it's always like I started by saying that this was a complicated issue, but I think really Jordan's Principle, if nothing else, is an attempt to make it less complicated, to make it easy. We now have a single phone. And yeah, so it shouldn't be as complicated as it was. And I think we really have made some headway, particularly in the last couple of years following the Human Rights Tribunal decision. And really our thanks, and I should have mentioned at the beginning, our thanks to Dr. Cindy Blackstock for all of her work in leading all of this over the last 10 or more years that she's been really pounding this issue. So, Cindy's been great. We've had her at our conference for a few times. And if anyone ever gets a chance to hear her speak, I think it's always a great opportunity to learn even more about these issues. Mm-hmm. And again, if you do have any questions, First Nations Caring Society website is a great first step, and always follow up with Jennifer as well if you need anything.
Thank you all.
So we do our webinars, as most people know, on Wednesdays at 11 a.m. Eastern Time, and it's great when you can watch live because you do get to participate in the discussion and ask your questions and share your comments. But when you can't, we do record these sessions and make them available after the fact on the Knowledge Exchange Network. One more thing before we leave is I'll mention we do have information up on our website about the CAFC annual conference coming up in October in Edmonton this year. Poster, if people are interested in submitting a poster, this is the last week to submit. Friday is the deadline to submit a poster abstract. So please, if you are interested in submitting a poster to the conference, Friday is the deadline, so please have it in by then. Our next webinar is on June 6th, the next week, which will be on the ever-challenging issue of children with chronic illness who are transitioning to adult services. The webinar will be called Alberta Transition to Adult Care Innovations, and we'll be hearing from Dr. Susan Samuels and Gina Dimitropoulos from the University of Calgary to talk about initiatives and research that has brought together the children's hospitals, the community, and the rehab hospitals within Alberta through a collaborative research project to improve outcomes for children and families during and after transition from pediatric to adult services. And then following that, on June 13th, we're going to welcome Dr. Jim King from CHEO in Ottawa to talk about achieving epic benefits at CHEO. Good design is as important as good technology, and the epic we're referring to here is their integrated enterprise-wide electronic medical record that they have implemented, and they actually created a program to maximize clinician adoption through optimization of end-user experience. So for those of you who have gone through an electronic medical record implementation, it's always about making the end user, the frontline clinicians, understand why and to really get the benefits of that implementation. So we're going to hear how CHEO went through that process in a couple of weeks. So thanks again to everyone for joining us today. Great presentation today. Thanks again to Jennifer King from the First Nations Child and Family Caring Society. And hopefully we'll see everyone back next week. Bye, everyone.
Thank you.